My name is Ima-Abasi Bassey. I'm the lead pathologist for the CHAMPS project in Sierra Leone. CHAMPS is Child Health and Mortality Prevention Surveillance. Basically, we're there to find what is the cause of under 5 mortality in the catchment area in Sierra Leone, of course, with the idea of informing interventions, and so we have a huge amount of data that is translated to action, provides opportunity for governments and, partners to decide what really works because it's evidence-based, data-driven. So that's what I do.
Thank you, Ima, and thank you for your time. What has inspired you about the forum so far?
It's been a very...
Sorry, because I didn't tell you that if you can start with the question, what has inspired to me
right.
more. Sorry,
okay.
I didn't tell you
Fine.
before, but it's better you.
Yes. Okay.
And so, okay. So, what has inspired you about the forum so far?
What has inspired me about the forum? It provides opportunity for interactions. You're able to share experience, opinion, ideas and all of that. You just meet various people working within the child health sector. That's particularly exciting for me. It provides opportunity for provocative dialogue, really, and also learning how others do it, what has worked for others, and you're able to determine a few things that you think you can take back and suggest, for the country I'm coming from, which is Sierra Leone, where we work. So that has been really good for me. Just being in a room full of people who they're thinking child health. And somehow they can identify. And it's also been interesting to know that your experience is not, would I say, just unique to you. Some people have similar experiences. And therefore, whatever interventions they've done can be useful. It's been that kind of thing for me. Yes.
Okay, thank you. And when you return home, what is one thing that is going to change as a result of the forum?
When I return home to Sierra Leone, I don't know if it is what would change, but what I would do better, what I would be more confident to push, what I'll be encouraged, because the CHAMPS project, for example, doesn't just... We sample children, right? And we determine what kills them. We do testings. We bring together a wide variety of things. We bring together the social environment of the child, the family background, the clinical information. We do verbal autopsies. We even get, information about narratives, from the mothers and all of that. We put all that together. And we had found out that there's a lot that contributes to child mortality and consequently can also help improve child survival. That doesn't always have to do with, would I say, a lot that are systemic issues, right? A lot that have to do with community perceptions. So yes, the child would have benefited from a certain kind of drug, if he came to us. But it would have helped if the mother had done this earlier on, right? Just many things. So our approach when we're looking at action, data to action, is a holistic thing that says the problem doesn't always have to start within the health system. Sometimes it starts at home. Sometimes it's not even the core medical knowledge, but perhaps systemic issues within the hospital. And just having interactions and talking to people, I think that's the way to go about it. So if I go back home, what would I do? I would say, let's keep doing this, or let's, up the tempo. Yeah. Okay. That is one thing that stands out for me. Just even talking to people.
Okay.
Yeah.